Hello and welcome back. I am Ashok Rajguru, your instructor. Now we shall be looking at what happened to our patient who had reported very promising findings after the first 3 weeks. So in the following slides, we shall just go through some very interesting developments. You will recall that at the end of 3 weeks, the patient came back to us. He had been prescribed Kali Carb or Kali Carbonicum 30. And the patient said that he was free from all symptoms at 3 weeks. He was sleeping well. He did not have any disturbing dreams or dreams of people who were long dead. And as a matter of fact, he said that he had not reported one symptom, which was a long-standing dandruff which would itch. Even that was gone. So that was something that was very encouraging. The patient came back after 2 months following the 3-week follow-up. He said all his nose symptoms were back. The violent sneezing, the excoriating nasal discharge, everything, except of course the dandruff, which seemed to be absent. So quite naturally, we repeated a dose of Kali Carbonicum 30. Initially, it showed a slight improvement, but in less than a week, it became worse. So the next choice was Nux Vomica 30, which was the second best indicated remedy in our previous analysis. Still, there was no improvement, and in fact, the patient had to use the decongestant for symptomatic relief, and that is what brought him back again. So during the course of this time, that is between the worsening of his symptoms and coming to me, he had to undergo one routine medical screening for his health insurance policy renewal. So he had to go through a battery of tests, and in the next slide we'll see what exactly those tests revealed. Now these are the routine screen findings which are listed here. His ECG was normal. His chest X-ray showed no abnormality. His lipid profile was normal. His urine and creatinine analysis also showed that his kidney function was normal. His blood sugar before early morning fasting as well as after eating, preprandial and postprandial figures were also normal. But one particular parameter which was of tremendous concern to him as well as to me was that his blood pressure was showing 210 by 100. But he was asymptomatic for any cardiovascular complaints. He did not have any kidney complaints. He did not have any blood sugar complaints. Otherwise also he was quite fit. But this blood pressure was quite an alarming number. But despite this high blood pressure, the patient attitude was quite positive. He was not on any medications which are normally indicated for a person who is around 60. He was not on any blood pressure medication or any other medication for that matter. And he was quite determined of addressing his issues with homeopathy, and he wanted to avoid allopathy at all costs. Of course, both of us realized that there was an immediate concern of the need to control hypertension. Another thing was that the spray that he was using for the nasal congestion or the nose blockage that he was suffering was the same Otrivin, which is a xylometazoline product, and that is contraindicated in hypertension because after all it's a vasoconstrictor, so it is going to affect in other parts of the body as well, as allopaths are now realizing. So the need of the hour seemed to be an intercurrent remedy to address his immediate problem of hypertension. Now herbalists have been using this particular drug, Rauwolfia serpentina. It grows in India and Sri Lanka in the tropical climes, It has been used for many, many centuries. In fact, Alexander the Great, when he came to India, was also administered this particular remedy for some kind of a poisoning. It has a long user history in traditional Chinese medicine and Ayurveda. And as a matter of fact, it was the first allopathic drug which was developed specifically for hypertension. This was Dr. Vakil of Bombay, who was at that time doing his research in the United Kingdom. And he had read ethnobotany and decided to experiment with this particular drug, and he cured a large number of patients. And then his findings were published in some of the most prestigious publications, peer-reviewed journals like Lancet. And for the next many years, raw Wolffia serpentina extract and later its active principle, rezapine, became the principal medicines for hypertension in allopathic medicine. They also had used this particular drug for schizophrenia. But very soon, I think within about a decade, this drug fell out of favor because it had tremendous side effects, which we'll talk about later. And probably this drug would have done better in the allopathic repertorium as well if they had been open to the idea of dilution and potentization and of prescribing on the basis of symptoms and seeking cure by the principle of similars rather than contraries. So very briefly about this drug. This is a herb or a plant which grows, as I told you, in India and Sri Lanka and some other parts of Asia. And it was proved by Templeton in 1954, between 1954 and 55, which means say about within 5 or 6 years of its being accepted in the allopathic practice. Surprisingly, what he noticed was that in the provings, he came up with the same harmful side effects which were used by allopathic users and which led to its expulsion from the allopathic domain. In particular, it has a concomitant of a stuffed nose and elevated blood pressure. So this was the reason why I decided to choose this medicine for our patient. You can find references to this in the British Homeopathic Journal of April 1996. Now briefly about the case management for this patient. I prescribed raw Wolffia serpentina mother tincture 5 drops 3 times a day along with Crataegus 5 drops 3 times a day. Now Crataegus has been prescribed because it is also a heart tonic. So Borike mentions that it acts on the muscles of the heart and it is a heart tonic. The prescribed dosage is from 1 drop to 15 drops of the mother tincture. But it must be used for some time in order to obtain the results. So the patient was prescribed raw Wolffia serpentina 5 drops 3 times a day and Crataegus 5 drops 3 times a day. Let's see what happened after that. The patient came back for a follow-up 10 days later and he reported that the blood pressure had now dropped to 145/90 and after 3 weeks it was between 125 and 130. He had been checking this 3 times a day and unfortunately the stuffy nose showed no improvement, and he said that he felt as if he should use the xylometazoline nasal spray, but he had been avoiding that because it was contraindicated in the condition that he was also having as a concomitant, which is hypertension. He also reported a dry mouth. So we discontinued Crataegus mother tincture and changed the potency of raw Wolffia to 6C. So he was given Rauwolfia 6C, 2 pills, twice daily. And a week later, he reported that his nose had cleared up and that he did not have any desire for the nasal spray. So the question that arises in our mind is, indeed, the Rauwolfia serpentina had helped, the mother tincture had helped, and he was doing even better on the potentized 6C remedy. Now, was it suppression or was it a palliation on the principles of allopathy, or was it homeopathically prescribed for his case? Now, if we look up the complete repertory 2014 edition, which I had been using at that point of time, we find that it covers all the rubrics which the patient had been reporting from the beginning. Raulfia has got a 3 a.m. and a 8 p.m. aggravation. It does have dreams of dead people. The sexual libido is diminished. There is a lot of sneezing, nasal congestion, and the strong modality of cold air aggravation. But as we know, this is a very small. So what are the lessons that we learned in this case? This case taught us quite a few important lessons. You see, the patient had been free from symptoms for a couple of months. So obviously he has come to us with an acute manifestation of a deeper, more chronic condition. Rauwolfia, as we saw, is a very small remedy. So it does not appear in our conventional repertorization. In fact, many of our standard reference works like Pathak's repertory and Pathak's Materia Medica, Roger Morrison's Desktop Companion, all these books do not mention Rauwolfia at all. The discovery of the connection between rhinitis and hypertension came up only because this particular patient exhibited these two comorbidities or concomitants together. And of course, reading through the provings and the clinical symptoms of Rauwolfia helped a great deal. It was quite an accidental discovery because if the patient had been, like most other people of his age, been on a routine medication for hypertension, we would have missed that important link and we would not have been able to discover what actually applied to this particular case. Now it is time to think of the way ahead. What if the patient returns back to us after a few months of being symptom free? Obviously, we have to address something that is deeper. If we go through the provings, we find that people who were the provers of this particular remedy, Rauwolfia, had reported that their stool cultures had shown an increased number of colonies of Morgan-Gettner. This could probably be a bowel nosode that could help him in the future. There is a very strong possibility of that. This is of particular interest to us because in allopathic literature, we have another paper that we can refer to, which says that in children, they were able to treat perennial allergic rhinitis with lactic acid bacteria. It's a very interesting paper and it reminds us of the seminal work done by Dr. Edward Batch and Patterson and their publications on bowel nosodes. This paper summarizes that the prevention and treatment of allergic disease is possible by modifying the gut ecosystem. So we can always keep that in mind. Bowel nosodes are much underused in our practice, but they can be of tremendous help when it comes to dealing with such chronic cases. I shall now summarize the principal points that we covered in this particular presentation. We saw how important it was to have a good understanding of pathophysiology of a disease. Pathophysiology, pathogenesis, which means how a disease develops, and symptomatology, that is, how symptoms are manifested on a patient. These 3 points are very important if we wish to understand what is peculiar or what is individual about a particular patient. The second thing which was important in this presentation was the role of intercurrent remedies. Then we saw how important concomitants are. One good book I would recommend is Just You See, written by Dr. Sunirmal Sarkar of Calcutta, India. The book contains a large section of materia medica, which is based entirely upon his clinical experience and information derived from standard materia medica written by classical homeopathic masters. Also, we saw how important provings are in order to understand and differentiate between remedies. Provings are the very fountainhead of all the knowledge that we have about remedies. It tells you much more than what materia medica, because a lot can be lost in the translation when provings are rephrased as materia medica. And lastly, we saw that bowel nosores can have a very positive role to play. They are much underused and not well represented in our repertories. So we have to still depend upon cross-referencing from our books. In the next video, which is also the last video of this particular continuing education unit, we will look at alternate and supporting healing modalities such as nutrition, diet, lifestyle, and exercise. This is very important because as homeopaths, we should be able to advise our patients on these points, which can make a big difference on the path to recovery. So thank you very much for your attention and see you in the next video soon. Bye bye.